Hi, my name is Kim Soo. Welcome to a beautiful night here in Brooklyn, New York. I run an acupuncture practice called The People's Acu. The People's Acu is an anti-capitalist project which makes alternative medicine available to those who ordinarily would not have access to those services. Every client contributes and supports the project, and those who have more resources contribute more so that those who have fewer resources can access the same healing. This video is about how I like to treat the neck and upper trap using a combination of dry needling and joint needling. Neck and upper trap pain are among the most common complaints I see in the clinic. They make up probably more than 1/3 of all the complaints that people come in asking help for. There are a lot of symptoms that can go along with neck and upper trap pain. These can include pain, numbness, tingling, other abnormal sensations like heat or cold, lack of feeling, lack of strength, lack of motor control. These symptoms can appear in the neck, they can appear in the upper trapezius, what a lot of people commonly call the shoulder. They can appear in the shoulder area, in the chest, in the upper arm, forearm, the wrist, the hand, the fingers. Indeed, a lot of the symptoms caused by muscular trigger points and joint compression that happen in the neck or the cervical area can cause a wide variety of symptoms. So I'm going to do another video about all those different types of symptoms later. Which brings me to my strategy. I find it really helpful both to release trigger points in the upper traps and the neck and to needle a few of the joints in the neck or the thoracic spine. When combining this dual approach, you and I will get the best results. Most acupuncturists do this without even thinking about it because the majority of the traditional acupuncture protocols that you find in books or that most people know already include areas that are over or close to things like trigger points, motor points, or are in the important joints of the neck and upper back. Here are the ones that I prefer. For the muscles, I always include the main trigger point in the upper trapezius muscle. For all my acupuncturists out there, my point location is somewhere between the trigger point and the motor point, where we think of gallbladder 21. Do it by palpation. Get to know the fibers so you understand what to expect, and when you do find something unusual or out of the ordinary, that's what you should needle. Barring that, I just find fibers that are tight in the area that we've been shown are most likely to be harboring trigger points or motor points, and I go for those. The results are good every time. For my clients, what you should be feeling with dry needling of the motor points and trigger points is a dull, achy sensation in the muscle. Maybe sometimes there'll be a twitch. I found either one to be effective. It's not about the twitch, it's about the dull ache. And your acupuncturist should be able to tell you in real time which points you should expect a dull ache on and which points it really doesn't matter. Like the joints, not as important to have a dull ache in the joints. On some muscles, you might not get any sensation, and this is acceptable for muscles such as the levator scapula, the rhomboid muscles, or the spinal erector muscles. All release well with minimal needle stimulation or without a dull ache. There's also risk of needling these specific muscles, which all acupuncturists are familiar with. I won't go into those here, but we can deduce that less is more with higher risk areas. I usually also needle a few of the muscles on either side of the cervical spine. These are the ones that extend the neck and turn it to one side. So if you can't lift your head or turn your head without feeling pain or stiffness, these are essential when building a point prescription for you. We always consider how much needle stress someone can tolerate when choosing how many points to needle. So if someone seems robust enough that they can tolerate a few more points, I also needle the levator scapula muscle and the thoracic spinal erectors. The levator's job is to elevate the scapula, also to round the shoulders, and to turn the neck. For my clients and my acupuncturists, this muscle is thin enough that we're probably not going to feel that dull ache. It will loosen as long as we locate the fibers accurately. Again, feel enough of these under the hand and you'll start to very easily discern which ones have knots and where those knots are. That's where you want to needle. For this client, you can see that I've added additional points to the upper trapezius muscle. The central trigger point is the most important and most influential for this muscle, but sometimes I find that the fibers in the anterior portion of the trap are intensely reactive. This is the crook of the neck, right where you get that nagging sensation after we've slept wrong. When the fibers here are actively painful, they twitch and flutter just by touching them. She was robust enough to handle a few more needles, so I added these for her. It takes about 10 minutes to administer a treatment of this sort, which is not too long of an experience. After that, I give you about 15 to 25 minutes to rest, during which time a lot of people fall asleep. During that time, your body begins to heal. The muscles release, the blood circulation dilates and then calms down, the immunity becomes active, and your energy begins to move and equalize automatically. After this, we may do other modalities such as joint mobilizations, cupping, gua sha scraping, or counseling, or movement. All in all, it's a great experience, a tremendous break from the day, and a chance to be cared for a while, and to introduce a different cycle to your body, a cycle of healing. I hope you've enjoyed this video. If you'd like to make an appointment, you can do so through the link in my bio or on my website. Those links will be in the YouTube show notes or on my Instagram bio. Thanks a lot for joining me.